Pediatric rashes. How to correctly diagnose pediatric exanthem diseases. A 4-year-old boy presents to your office with fever and a prominent rash on his upper body. The young boy appears to be quite ill. His parents report that the rash appeared yesterday. 6 classical pediatric exanthems immediately come to mind: measles, scarlet fever, rubella, also termed German measles, Erythema infectiosum or 5th disease, Roseola infantum, and Varicella, also known as chickenpox. How do we correctly characterize the patient's rash on close examination? The characteristic distribution and morphology allows for differentiation. In measles, there is an erythematous, partially confluent exanthem of a dark red color, which usually begins behind the ears and disseminates to the rest of the body. In addition, there is also a pathognomonic enanthem of the palate, as well as Koplik spots, which are clusters of white lesions in the mouth of the patient. Conjunctivitis is also observed in the majority of patients. In scarlet fever, there is a fine, light red and maculopapular rash that develops into a scarlet-like, partially confluent rash after 1 to 2 days. The rash initially begins on the neck and spreads to the rest of the body. It is usually most pronounced in the underarm and groin areas. Non-blanching petechiae, or pastillas lines, may also be present. The patient's face is usually red with perioral pallor. Another classical symptom is a bright red tongue color with enlarged papillae, also termed strawberry tongue. If the patient's rash presents as non-confluent, pink, and maculopapular, then it is most likely rubella. Like measles, the rash begins primarily behind the ears and extends to the rest of the body. Patients with Erythema infectiosum, or 5th disease, do not necessarily develop a rash. Red papules may emerge on the extremities and trunk that eventually adopt a lace-like reticular appearance. In addition, a blotchy red rash may appear on the cheeks, which group together within a few hours to form red, slightly swollen warm plaques with nasal and perioral sparing. Because of this redness on the cheeks, Erythema infectiosum is also termed slapped cheek syndrome. If the patient's rash is patchy, rose pink, and usually most pronounced on the torso, then it is characteristic of Roseola infantum, which is also called exanthem subitum, or 3-day fever. Before the exanthem phase, patients experience a febrile phase with 3 days of high fever, followed by a sudden decrease in temperature. Finally, the rash could also be chickenpox. The rash observed in chickenpox is widespread, affecting the entire body, including the scalp and oral mucosa. It begins with the appearance of small red bumps that develop into fluid-filled blisters and pustules that finally form scabs. Because the rash simultaneously occurs in different stages, the term starry sky is sometimes used to describe this characteristic clinical finding. Now back to the young boy mentioned at the beginning. His diagnosis is chickenpox, which is evident from the different stages of blister formation that form a starry sky appearance.